the question comes from people, as I said, is it harmful or it's not harmful? And we know that a number of substances, activities are hazardous. And hazard is not the same as risk. Hazard is just a property of the substance or property of activity. Jumping with the parachute is dangerous, hazardous. Yeah, potentially it may happen that something doesn't work, but it is not very common, and people do it because they take this small risk. The same is with environmental exposures. We have various hazards. But we also know that not all hazards lead to visible or appreciated health effects. With air pollution, when we discovered the magnitude of the risk, it appears that all, as I mentioned before, all levels of exposures are actually increasing the risk in a measurable way. So it's not something which some time ago we considered 10 to minus 5. It means one case per 100,000 people over the lifespan appears in addition because of this exposure. No, we are talking about percents. I mean, few persons per 100 can get ill or can deteriorate in illness because of the exposure. And then question comes, okay, so tell me how much. And this how much can be responded in relation to the population. I will not say how much is your risk increased. I can say this in probability terms. Yeah? Probability of you or me getting sick because of this level of exposure is such and such. But it is better to talk about the population, and we can say, for instance, what percentage of certain disease is associated with the exposure. We can estimate it knowing the level of exposure. If we know also frequency of this disease in a population, we can easily calculate how many cases additional are due to the exposure. And if we know what is additional incidence due to the exposure, and if we know the size of the population, we can count number of cases. So the outcome of this exercise is simple and can be communicated in simple terms. Calculation is also not very complicated as long as you know what is the association between level of exposure and the risk. This is a complicated part. And there is task of epidemiology. In some cases is also task of clinical science, but in case of air pollution, there is mostly epidemiology, which is estimating the risk.